I'm Deepika, and myself along with Robin, Dazal, and Mari will be discussing diabetic neuropathy today. Diabetic neuropathy is a common complication of diabetes in which the nerves are damaged as a result of hyperglycemia. Mrs. S, as a 62-year-old woman, was medically diagnosed with the peripheral diabetic neuropathy. Mrs. S's previous occupation was as a dressmaker, and she looked after her grandchildren in the afternoon. She was a member of a women's social club at church and attended weekly and monthly outings. She enjoyed shopping and cooking and taking her grandchildren for walks to the park. Symptoms include type 2 diabetes for the last 20 years, severe weight loss, numbness, cramps, and insensitivity to pain and temperature, loss of balance and coordination, as well as muscle weakness and accompanying depression due to health problems. The condition has been further complicated by the onset of peripheral neuropathy last year, which can occur in long-term diabetic patients. Due to a weakness in her legs, Mrs. S could no longer climb upstairs independently and do unaided sit to stand. Obviously, Mrs. S continued with the medication for type 2 diabetes, but further conventional medical therapy could not help her neuropathy, and the medical doctor referred her to integrated therapies in order to arrest the neuropathy. Due to a physical status, the treatment options were limited. The causative factors for diabetic neuropathy could be diabetic mellitus type 2, family history of diabetes, age, as well as hyperglycemia. Complications include prone to fall, depression and psychological disorders, contractures, pressure sores, as well as burns, vascular disorders, and decreased cardiovascular endurance.
The impairments were identified as balance, decreased muscle strength, poor coordination proprioception, and insensitivity. So the therapy management will focus on improving impairments to achieve the long-term goal of restoring the patient's functional ability so that she is able to return to a previous occupation and also to be able to enjoy her hobbies. We will now be discussing the physiotherapy management we will use according to literature review.
For intensity, we will focus on educating the patient to avoid any burns and accidents that can happen due to loss of temperature and pain sensation. Then, for balance, we will have the patient in sitting, and with the patient giving the therapist giving the patient objects to reach for outside of the basic support.
Go. Good. Second me. Okay.
Okay. In the second exercise, we'll have the patient sitting on a ball. Now sitting on a chair, pushing the ball forward with her hand.
Okay, can you just roll the ball to the front? Then go to the back. Coming into the front. Okay, go to the back. Okay, pass down. Okay, to the back. Okay.
Okay. Then another exercise we have is with the patient sitting on the ball, and then she must maintain this position for 1 minute, trying to keep her center of gravity inside of the base of support. Then finally, when the patient has managed to do this exercise by herself, the therapist must apply pressure or resistance, and the patient must try and keep herself on the ball.
And now we have some resistance. Into the other side.
For hyperglycemia, we will use cycling with no resistance to improve cardiovascular endurance. And then for muscle strength, we will use theraband exercises for strengthening of the quads.
Okay.
The patient will be in sitting, and then the physio will instruct the patient to lift the leg up towards that.
Okay, can you lift your leg for me? Get your head again, lift my hand. Okay, down again. then you go up, okay, then you go down here, and up again, and go slowly down. Okay, so this procedure will do 10 to 15 minutes, and you'll do it 3 to 3 times.
To improve coordination, the patient will be instructed to kick a ball towards a target.
Okay, can you do the ball to my legs, please? Here we go.
And another exercise we have is with the patient in parallel bars, assisted by the physiotherapist, and then the physiotherapist must ask the patient to step on the stickers or papers.
Can you step on the white paper? Can you come towards me, please? Can you step on the white market?
For stair climbing, we will assist the patient with isolated knee control by using parallel bars and a step inside of the parallel bars to assist the patient with gaining strength and mobility independently.
Okay, me. Okay, so before climbing the next step, put all your weight on this knee. Control the flattening. Okay, and keep it flattening. Bring that down. Okay, up again. Okay, this is isolated knee movement.
While the patient is doing the exercise, especially the isolated knee control or parallel bar standing, it's important to tell them to remain looking in the mirror so that they can see the errors that they are performing or how they are performing the movement and how to improve the movement. So each one of us will demonstrate a home exercise for the patient to do should he or she be discharged and to continue with the rehabilitation process.
Okay, so exercise to strengthen your calves would be to stand right in the counter and just elevate your calf up and down. And stand in terms as well.
Another home exercise they can do to strengthen their upper limbs is to sit on a chair and with their hands supported on the side or armrest and move their whole body forward and then just use their upper arms to lift themselves up and down. They will need later if they to go into a wheelchair or need to transfer to the floor. Each exercise should be done